Well, moms, listen up. We are here in Tyson's at RxWellness Spine and Health with our good friend, Dr. Phil, who's become a familiar and trusting face, and especially, for moms. Let's first start talking about how our body changes during pregnancy.
Okay. When a mom is pregnant, within the second or third month, sometimes if it's a second pregnancy, they're going to start feeling pain immediately. There's this chemical called relaxin. Relaxin relaxes the ligaments, and the ligaments have to be relaxed for the body to make room for the baby. Now, when that happens, first of all, you're going to have 20 to 30 pounds of baby in your belly, and those relaxed ligaments are going to pull on the lumbar spine, the low back spine. So people are going to start having low back pain.
So that's why I wish I had known you when I was going through my pregnancy, and I'm hoping that so many of our moms will be able to reach out. So what are the things that you do to help us feel better?
Well, the first thing is this. There's this thing called the International Chiropractic Pediatric Association. If you're seeing a chiropractor that specializes in children or pregnant women, they should be certified by the ICPA. It's a really important certification. They put these chiropractors through training, get everything prepared, whether it be the breech training technique, how to take care of moms that are pregnant properly. Okay, there's a right way, there's a not a right way. Okay, but it's gently. But I will say this, when a mom is under chiropractic care, their births typically are a lot easier because once the pelvis is properly aligned, the baby can go through easier.
And that makes a lot of sense. So it's almost better before you get to that pain, maybe to come in earlier to get your body right.
Yeah.
And then you're going to have a lot less pain, afterwards as well.
Typical labors are going to be less time with a person who's been under chiropractic care than with a person who's never been under chiropractic care.
Talk about, how long of a session are you going to need? How often should we be coming to do this?
Well, look, each person is different, but I tell this to moms. As their baby's growing inside, you're probably going to need chiropractic care a little bit more. We'll probably start them off once every 2 weeks. Then it might go to once every week. And then there have been some moms that have come in to see me every other day because they feel good for 10 hours, but then the pain starts coming back in again. They wake up in the morning sleeping on the wrong side, and you've got 30 to 40 extra pounds of amniotic fluid in the baby and everything else in that belly. And they're like, the baby's sitting on my sciatic nerve. Can you get it off?
Exactly. Well, and speaking of that, I was lucky enough to talk to one of your patients, Suzanne, who is pregnant and had the same thing, and you have really helped her. Take a listen.
This is actually my third pregnancy. My first two, I had sciatica and was on bed rest because the pain was so bad. And I've been seeing Dr. Phil once a week since I got pregnant, and no sciatica. I was hesitant to receive chiropractic care in general, but it has been the biggest game changer for me.
So what do you want to tell other moms?
I would say don't stay in pain. If you're in pain and you're pregnant, give RxWellness a call. See Dr. Phil or any of the other great doctors there. They'll take care of you.
Wow. You can hear, how helpful you've been to Suzanne, and I'm sure to so many other patients. I was lucky enough to get an adjustment from you as well, and I already feel a million times better. I know there are probably moms that are watching right now that want to get a hold of you. You're all across the DMV, and you guys take insurance.
We do. We take insurance. Just give us a call, RxWellness.com. We'll get you in immediately.
Dr. Phil, thank you so much on behalf of all the moms. We appreciate you.